Welcome back to our final segment of this edition of Chamber Exchange, the TV show. I want to thank our sponsors, Bank Hometown and St. Vincent Hospital, will help make the show happen. And in this final segment, I want to welcome Sheilah Dooley, who's the Executive Director of Pernet Family Health Service, and Joel Wallen, who's the Associate Executive Director. So we got the 1-2 punch here, Sheilah. So maybe for our viewers who might not be familiar with Pernet, Family Health Service, you could kind of just give us a little bit of a history of that.
Sure. Pernet Family Health Service is a certified home health and social service agency. We have a number of programs, but everything focuses around our mission to strengthen families. And in 1955, the Little Sisters of the Assumption came to Worcester and founded the agency. And their founder, back in Paris, France in the 1800s, was Father Stephen Pernet. So that's where the name comes from. But all of our programs, as I said, focus on strengthening families in some way. So we start out with maternal child health nursing. We do home visits to new mothers and babies. Some have medical diagnoses, but we also have a universal program for anybody who is a resident of Worcester to have a home visit, just for support, teaching, supervision, teach basic infant care, help with breastfeeding and screening for postpartum depression, teaching safe sleep, things like that. Then we also have early intervention, which is for families with children birth to 3 that have a developmental delay or they may be at risk of a developmental delay. We also have youth programming for elementary school, homework club, and older kids who go on field trips and teach responsibility and improve self-esteem. We have a parent aid program, which is for families that are already involved with DCF, the Department of Children and Families. So something's already happened in the home, so we go in and try to, give some intensive support. And we also have a daycare. We have merged 2 years ago with Webster Square Daycare. Right. So that covers the preschool, and we have 61 children there and 52 family daycare providers in their home. Also center-based activities like the food pantry. We'll talk about our poundage of food that we give out every week. We run out of food every week. And then we have Thanksgiving, holiday programs, a lot of family support. That's basically what we're about.
You mentioned kind of open to the city of Worcester, but kind of is there a particular area of the city? You're located on Millbury Street.
Yeah. We're right on Millbury Street. We're very close to Crompton Park, right, the Kelly Square area of Worcester, but we serve people from all over. But that we are neighborhood based, and people come from the food for the food pantry and other supplies. We have infant formula, diapers, sometimes clothing and cribs, things that people donate. But it's mostly the Green Island area of Worcester where we focus on.
Yeah. And some of those areas that you talked about, critically important. I mean, Worcester being a diverse city economically, racially, et cetera. The issues of maternal morbidity and child, issues around healthcare and young new births and trying to address issues really out of the gate. Early intervention is so critical, so that if there are issues, the services and engagement with the providers and then the school system is really important.
It really is, and Worcester is a great sort of safety net city too. We have a lot of resources that we try to connect with and make sure that families don't fall through the cracks.
Yeah. Joel, you want to jump in and elaborate a little bit more on some of the...
Yeah, I'll talk briefly about our food pantry. So over the past 5 years, kind of pre-COVID to then during COVID, and now we've doubled the amount of families that we're serving. At one point, we were kind of a smaller neighborhood food pantry, and we really expanded through some of our partnerships, obviously with the Worcester County Food Bank and some of the other local grocery stores, other nonprofits. We do 5,000 to 6,000 pounds of food a week that we're distributing. Even with that, we've just seen a significant increase in need. So nonetheless, even though we're distributing thousands and thousands of pounds of food every Tuesday and Wednesday, we really are running out of food each day within 2 to 3 hours. Over the past few years, we've also expanded our infant supplies. So we're doing 150 boxes of diapers a month that we're distributing to families. As Sheilah mentioned as well, infant formula and clothing as well. Through a partnership that we have with the City of Worcester, we were able to secure some community block development grant funding, and right now we're in the middle of a construction project to revamp some underutilized space that we have to turn our pantry into what's kind of known as a choice pantry model. This is an opportunity for families, rather than getting pre-bagged, grocery bags full of food, they'll be able to come into a newly renovated, beautiful mural in the space. An opportunity for families to come in, they check in, and then they'll be able to, what we're calling kind of shopping, be able to self-select food that best serves their needs and serves their family. So we're really excited about that. That's been a few years in the making as an organization. So we're excited. We think that that's an opportunity to better serve families and better meet their needs.
And that's important, just given the diversity of the city. There are different food tradition staples that
Exactly.
It's some it's meat and potatoes. Other it could be more
rice and beans.
Rice and beans. It could be more vegetable oriented. People, different families and backgrounds have different traditions, right?
Exactly. I think this is also coincides well with our 70th anniversary. So in hopefully next month or two, we'll be having a ribbon cutting for that space. So we'll obviously be inviting you in the chamber to participate in that.
And Joel's a graduate of the Chamber's Leadership Worcester program,
That's right.
Sheilah. You knew that, right?
That's right.
Yeah. So 70th anniversary, anything scheduled for that beyond the ribbon cutting? My guess is that you've got some.
We've had a series of celebrations. The biggest one coming up Thursday, September 25th at top of the tower. It's our 70th
We were
anniversary.
just talking about that earlier, transitioning now to,
That's right.
I guess, the
beautiful space.
Yeah.
As Amy said, stunning views, and we're trying to plan it around the sunset, so we have to make sure it doesn't rain that night. So, but we also had a client.
And maybe even from that floor, maybe see where you're located. Or certainly the street, Millbury Street.
Absolutely.
We can see the building beside us from the top of the tower. We're kind of blocked a little bit, but we're going to try to get a drone to maybe take a picture of it. We actually have a really nice video made by Burning Cedar Media, which is going to be spectacular that night. But we've also had a client picnic in Crompton Park, so that clients who can't go to the gala, had a big celebration with bouncy house and food trucks and things like that. We very recently just had a mass and a brunch at Assumption University. The Chapel of the Holy Spirit. The Little Sisters of the Assumption are part of the Assumption family, like the Religious of the Assumption, the Augustinians of the Assumption, and Assumption University. So that was a nice partnership, a nice celebration last week. And again, as I said, the gala is Thursday, September 25th at top of the tower. We will have a champagne reception, a silent auction. We've got some really cool prizes. Trip to the Caribbean and a house on the Cape in Chatham being donated. So hopefully people will come and bid a lot of money to raise for our programming.
Right, and so that funding is important because there's some government funding that you rely on in contracts, but then a lot of it's just raised privately and donors. Right.
We have 3 major state contracts. The early intervention is with the Department of Public Health. The daycare is early education and care, and then our parent aid program is through the Department of Children and Families. But we write grants, we accept a lot of donations, and we were very fortunate during COVID to get money from ARPA, the American Rescue Plan, some from, as Joel mentioned, CDBG through the city. So that has helped us because everybody is in the same boat, a little uncertain and not sure where cuts are going to affect us.
So if people want to learn more about the event, the scope at Pernet, contribute, volunteer, website?
The website is Pernet, P-E-R-N-E-T, familyhealth.org. You can go on, buy tickets. There's a button for the 70th anniversary. The ticket link is live.